everyone. Welcome to our Health Tech Wednesdays. Thrilled to be here. I'm Meg Columbia-Walsh. I'll be moderating today. And this is just a chance for all of us to get together and to be able to share and network and to meet some fabulous women. And we certainly have one today. We're welcoming one of our very own, which is Melissa Stockwell, Dr. Melissa Stockwell, and who is the chief of the Division of Child and Adolescent Health at Columbia's Irving Medical Center. Thrilled to have you, Melissa, and this is a casual chance for us to hear about you and who you are. And I like to start with that because it's always interesting to everyone of how you got to such a prestigious position and title. So welcome. So as a first question, why don't you tell us a little bit about yourself, and especially, you know, how did you climb to where you are today?
Sure. Thank you so much for having me here today, and I'm really excited to be part of this this chat with you. So I'm kind of wearing two different hats. So one is the division chief, and then one I'll tell you a little about the center that I know we've talked about that I run. So I trained in pediatrics and knew that I wanted to do primary care pediatrics. And when I was finishing my chief residency, was trying to decide what did I want to do next. And I kind of had this feeling that I wanted to do primary care, but something else. I just didn't know what that something else was. And in talking to then the division chief, whose job I now have, but many, many years ago, she had told me about a fellowship that was a primary care fellowship, which is basically being duly trained in public health and learning how to to do research. And I, probably as many women kind of thought, well, research, like I can't do that, right? That's not me. And so that was my husband or my brother or my father, and not something that I could do. But I decided to come and do the fellowship, and in my mind thought, well, I'll be trained doing program evaluation. So I came and I went to Mailman and I did my MPH, and then joined faculty and started to do a kind of landscape being able to run this project because my mentor had left, looking at the reasons that families failed to return for immunization visits. And so we'd done this, surveys and kind of figured this out. And I presented a national meeting, and a reporter said to me, "So interesting, what are you going to do about it?" And I was like, yeah, what am I going to do about it? And then I kind of found this sort of sweet spot of running, basically being a researcher and running pragmatic, we call them pragmatic clinical trials. So trials that are, in real life settings with our patients in our networks, where I can kind of answer this bigger question, but also then have something that's in service to my patients at the same time. So the idea of sort of service-based research. And I kind of talk about kind of zooming in and zooming out. So zooming into that patient in front of me, and then kind of zooming out to that big public health kind of picture. And then started to kind of interweave technology into it, because that's a really obviously great way to be able to reach across a population. And particularly in work in Washington Heights in our patient population, really that kind of health equity lens, that our families and our patients don't get left behind in this, in this world of digital technology. And so it kind of built this program as a researcher, and NIH funded, which if you told me 20 years ago I'd be NIH funded, I would have said, well, me, like that's not what I do. And then right at the beginning of the pandemic, became division chief of child adolescent health. And so that's what we here call, other places call general pediatrics, but for us it's general pediatrics, adolescent health, well, baby nursery, child abuse center was our child abuse pediatric group, and a bunch of other things. And right before I became division chief, I actually started a center, which now lives in our division, on children's digital health research. And the idea was to sort of be able to, look across this landscape and realize there's so much that's happening so quickly, and parents and families want to share that information with their pediatrician and their doctor. And we as providers don't know how to consume it, right? Like, how do we get all this information? How does it get integrated in a way that's actionable to us? And And then similarly, how can we make sure our families and our community don't get left behind? And so we kind of have 3 mandates in the center that we've mandated ourselves. The first is around research. So sort of, we know that there's kind of been this push that all technology must be good, and we know that's not true, right? So how is it implemented? What are the unintended consequences? But then also, what's that next thing that we can kind of think crazy things outside the box and move that forward? So there's sort of this research part to it. There's an evaluation piece. So we partner a lot with NYP and doing a big telehealth evaluation for them, for our patients, and then also for companies that are kind of interested in partnering to evaluate their own technology in the pediatric space. And then the third piece is education. So how can we help young faculty who want to get into the space and all the lessons that we've learned in some painful ways to kind of be able to move them forward faster and kind of pass on that knowledge as well. So that's kind of how I got to in a very compressed timeline, how I got to where I am.
But it's fabulous. I mean, one of the things I love, and I get this a lot if I'm mentoring somebody about your story, is that, you knew one thing, which is you wanted to be a physician. Right. But the way you talk about the genesis of your story, that research wasn't necessarily your number one, and then here full circle, you're now head of the division, which is an incredible accomplishment, by the way. But I love that, because a lot of people think, oh, I have to declare one thing, or I have to be one thing. And that message to me is really what I tell women all the time, which is you can do anything you want, setting a goal and working backwards, right? That we're not married in these boxes that we give ourselves, and there's so much opportunity.
Yeah, it's so true. Yeah, I'm saying actually just on that point, because at Columbia, I help run this Women in Science Symposium series. And one of our messages has really been, we actually call it perfectly imperfect, because I think we think everybody else had it all worked out, right? That from the beginning, you sort of knew this, you did this. And in reality, everyone's path is all twisty and curvy. And that makes it really interesting. And also if your eyes are open, gets you where you're going to go, because you learn from all of those things. And there's a through line somewhere looking back, you can see that. But at the time, I think we as women and other as well kind of think, wait, there's something wrong, right? Like my path isn't linear, and as opposed to, no, that actually is the normal, and that normal is great, right? And kind of embracing that. So I think it's true not only in science, but in technology, and I think in the world.
Yes, and I, in my own path, same statement. If you told me, oh, I would be, specializing in AI, and, I wouldn't have ever seen that, just by starting a company, I ended up in a certain way. And I think that is, a really positive, and that in each new track, you're not plateaued. If you start something new, you can also achieve great heights in that. So I love that. And I think that's terrific. So, hearing you talk about technology, obviously, because for Amazon AWS, we're on the other side of that, helping to get the vaccines out the door in 6 months versus 10 years. And it's been an incredible ride. So when you look at, reaching the community, now you mentioned the community, what do you see in the service of helping in the tech and communicating that you mentioned, and recruiting more people into the trials, which is so critically important? How are you looking at taking advantage of technology? How does that work for you?
Yeah, no, it's interesting. I mean, in some ways, for my own kind of research lab piece of it has really, just kind of focused on how we can use technology to promote vaccination. And we sort of thought of it as sort of socio-ecological model. And so kind of hitting these different places, and had done a lot of work on this, and it really kind of has come together in a lot of pieces for COVID vaccination, which I think has been really fun to see it that way. So we have historically had pieces, we kind of think of the individual level and the family. It's really, how do you have that family or that person, if it's an adult, have confidence in the vaccine, how do you help them get the information? And so we had done a lot of work on using text message vaccine reminders, sort of a way of embedding educational information. So you can do that large scale reach, but yet it can feel personalized, right? And get that information. And that works for, some families and works for families, and particularly partly education, but partly where to go and when, right? Sort of, you can come, click on this, make the appointment for this Saturday, or, all of that piece. And I think that's been, been used a lot. The kind of next piece is sort of the, moving out one level is kind of the friends and families and kind of community piece. And for us, we have not kind of gotten in the social media space. I think at some point I'm going to have to, although I'm a little bit reluctant, but we have had focused a lot actually with CDC many years ago in being able to kind of collect from participants themselves side effects of vaccination. And part of the thought is, particularly say for flu vaccine, I'm sure you've heard it too, right? A lot of people are like, I don't get the flu vaccine because, I think, I got a fever, or my child, I'm pretty sure my child got the flu from it. And it's not the sort of ends up in the hospital, right? It's not the things that we collect, from like the severe vaccine safety things. It's sort of and so we had kind of created a process to be able to use texting as a way to get that information back. And it's not the same system they used for VSafe, but VSafe is for COVID vaccine, the CDC pushed out and everyone, didn't quite work as I think the implementation, but really the idea was everyone was supposed to sign up when they got vaccinated and then kind of report their data so that they could get this kind of picture. Then as an organizational level, I've done a lot of stuff with clinical decision support. So like, how do we make sure that patient in front of us? So for example, I saw a patient yesterday for something totally different. I noticed she hadn't gotten her COVID vaccine booster. That gives me the and as I could go check and make sure I look, but when it pops up for me in this little box, then I know, okay, I need to go talk to them about it. And then on the community level, we've done a lot around surveillance. So using SMS in community-based surveillance studies, and we just finished 2 really big ones with CDC that we were fortunate enough to be a site for, to really understand from the community level, what is, who is getting COVID and what's the transmission risk, and being able to answer these questions, particularly in pediatrics, to then inform, we do want to get vaccinated because, X, Y, and Z. And there's sort of the policy level. And so I have worked with our city registry. So New York City particularly has an amazing city registry of how do we exchange information around vaccination, so that we can, again, make sure that we as clinicians, and we're seeing that patient in front of us who now could be vaccinated anywhere, right? The pharmacy, this place, that place, how do I know at point of care if they got it or not? And how can I trust that information? So vaccination is like a perfect place to really use technology. And then not even the whole logistics part of AWS, of how do you even get the vaccines to the place, and, and supply and inventory and that whole piece to it too.
Yeah, it's incredible. I mean, one of the things that has been amazing to watch in the last 2 years and very beneficial is, and this is my personal drive, has always been the patient. I'm older. When I got into technology, it was about compliance that when we first did informational internet sites, we thought, oh, maybe they'll comply now, they'll understand. One of the things that I think happened in the acceleration of the last 2 years, as far as the patient is, they saw they could do the text, they could schedule for healthcare related issue. The other phenomenal thing, I think, is that people got on telehealth calls with their physicians. And I think that's phenomenal because a lot of people just don't go. So the non-compliant, there's of course people that go, but reaching people who don't, or neighborhoods who don't have access. So to me, we just trained an entire nation in now how to do telehealth and how to do texting and how to schedule healthcare appointments, and just how important it is. Do you see in your own work here that telehealth now and that part of the technology is going to be a great benefit to you?
Absolutely. And it's so interesting, and in retrospect, looking back, because we're just starting our telehealth program right before the pandemic. And in pediatrics, we were sort of thinking very gingerly, like, okay, how would this work? And, we were going to say, okay, we hired one of our new faculty, like this was going to be her thing. And she was going to start a little bit and how we were going to do it. And then, everything went sideways fast, like super fast. And that's when I took over as division chief. And, we consolidated all P's to one site from our 4 sites. So it was this huge kind of practice redesign, and never stopped seeing patients because our patients needed us, right? So we're really focusing on particularly those younger kids we bring in. But then we had a whole slew of patients who needed to talk to us, but but not see us. And so we all got trained in telehealth, like lickety split, as you said, and really just figure out how to make it work. One thing that the hospital did very well was they actually, again, from a health equity lens, not going to leave our families behind, really have this kind of wraparound care of how to get our families connected, how to, getting them on the platform, like really how to use it. And then we as pediatricians are very good at sort of, we made our appointments 30 minutes, even though it really only takes 10 minutes, because we know like someone's gonna get on, then we call them. And then, sometimes we have to, flip to Doximity or whatever it is, like, so that we can, get them on if they can't get on the platform. And it's worked incredibly well for pediatrics. And we're just doing an evaluation now for the hospital that really has shown that our families, which are, primarily publicly insured, many Spanish speaking, really do use it, want to use it. And so this kind of refrain of like, they can't or won't is not right. And we have to have this health equity lens and make sure that we are people, we're giving the support around that, because families really do want it. It's much better for them. We used to, have what we consider great access, and that people could just walk in to be seen when they were sick. The problem is they could wait 3 hours, right, in the waiting room.
Yeah.
And that's not good for a family who has, has a lot of other things that they can do. And my best story, I think, and this is during the pandemic, is one of our doctors in our division was doing a televisit, and she noticed the family was outside. And so she said, oh, do you want me to call you back in 10 minutes? Like, do you need to get inside? And she realized that mom was actually online at a food pantry. It was like right in the middle of the, of that spring. And so she could then talk to the mom and give that family support exactly where that mom had it to be at that time. If that mom had to like come to the clinic to be seen, she would have had to choose between, feeding her family and getting her child the medical need. And that's an extreme example, but in some ways that really is the promise of telehealth, right? Like we can meet that family where they need to be at that time, and give them what they need and not make them travel to us. There are other things that have to be in person, right? Our well child telehealth did not work, right? We have to see the baby, we have to weigh family, to talk to them, examine, but for so many things. And so we weren't sure, how much we would keep, but we have kept so much of it, and we're never going back, because it really has worked so well for us and our families.
Yeah, I think that's, whenever we release some new technologies, as we've all seen, mobile, social, digital, there's this huge learning curve, and then you really only get a certain part of the population in. So we know text is the whole population, right? Everybody has a phone. Right. I just love that we doubled our numbers, is the way I look at it. As somebody who would think about trying telehealth, had you just branded it and advertised it prior to the pandemic, you would get X amount. But now, like this woman, they were like, I have no other choice, or we have COVID, we can't leave the house. I mean, my children had potential strep throat during the pandemic, and the office said, we don't want you to come in yet because of the pandemic. And the doctor got on the phone, and they're doing the laptop and opening their mouths and shining the flashlight. It was just, for me being in tech, I loved watching what I was watching. It was so fantastic.
It's fun to be the parent on the other side of the tech part of it.
Yeah, it was just really great. And, even some of these older fashioned physicians who this woman happened to be, here she is. She's like all in, right? I'm doing this. So that's great.
And we made it in early on that all of our, like, everyone's going to do telehealth. Like we weren't going to have, some people do and some people not. So really our whole group practice, everybody does it. Cause I think it's an important skill for everybody to have as well.
Yes, it's great. So I do have one question. So it's a little more technical from
Sure.
our audience, but audience watching, we can't see you, but we're happy to, for the few minutes we have, answer some questions. So one of them was going back to the more technical part of your job. But in the studies, there's an interest in the NIH and question about the long COVID.
Yeah.
And I'm sure as it relates to children and adolescents, and what kind of studies you're doing. That was one of the questions we had.
Yeah, so we actually just were selected and signed to be one of the Recover sites. So we're one of the pediatric adolescent sites, so at Columbia, and so we're working with other sites around the country, along with NYU, which is the Clinical Science Core, and NIH, to very shortly start the pediatric version of like, again, Recover is the long COVID initiative. There's also an adult initiative too, which is a few weeks ahead of us, but it will be going live soon. So be on the lookout, and we'll be recruiting. We'll kind of be recruiting in around the medical center in New York City, and then there are other sites around the country that are also recruiting. And I think it's going to be, certainly something that's really important. We don't really know what long COVID is in kids. We know it is something, but we don't really understand what the prevalence is, in part because part of this recovery do is we're going to be looking at kids who have not had COVID, because there's also something about just being a child in the pandemic. I know you probably know from your own kids as well. And so we really need to kind of tease apart that piece, that what's the sort of biology from having had COVID, and what's the sort of biology from just living in this last 2 years when you're a kid. And it's just been really, really, it's been terrible for everybody. It's been really terrible for children and adolescents. So we're really excited to be part of this group and to do this really important research.
Yeah, that's just fantastic. I have twins and they're 18 who had COVID, also vaccinated, boosted, etc. And it's really was somewhat of a petri dish, because again, my background, but watching the different twins that are so close in so many ways, and the different way in which COVID manifested it inside of them. And I think that was one thing, and my daughter's still lingering symptoms a little bit as a athlete, showing signs respiratory. And then also, the hit with Omicron for our adolescents who had just finally felt a little freedom, I think was very powerful. So, I think your work is really important. And I'm so, sharing with people who are joining this is just fantastic. It's always too short, but we're thrilled to have you as part of the family. And for everybody in the audience, thank you for joining. We hope that you'll share these, because we'd love to get more women involved and grow our community. So we're thrilled to have you. So thank you so much for joining us.
Thanks so much for having me. And as you told me, it would go very fast, and it does.
Yes, it does. Yeah. Well, we're thrilled to have you, Melissa. Thank you so much.
Thanks.
Bye, everybody.
Bye.